Hello, welcome back to Political Science 400, 500C, Public Policy for Health, Security, and Resilience. My name is Nathan Myers, and this is a presentation for the material in week 4 of the course, focused on risk communication and communication strategies. And I just wanted to take a few minutes to talk about another article that I co-authored that's available in the modules that again focuses on issues relevant to risk and crisis communication. This one again focused on zoonotic laboratory research. So research on viruses that can affect animals as well as human beings. So some of the information is similar to information that we've already covered in discussing the previous article when we're talking about the culture-centered approach. I do want to talk a little bit about in the areas of opportunity section. It talks about information from a gain of function symposium that was held back in 2015, which is obviously, pre-COVID. But it talks about information conveyed by a scholar named Monica Schock-Spana. And she talks about community engagement and how it involves 3 modes: communication, consultation, and collaboration. So the idea is, communicating with the public, conveying information to them, which we've discussed quite a bit over the last presentations, consulting with them about potential actions that could be taken or steps that could be taken. So working with the community, not just telling them this is what's going to happen, but consulting with them to look at the various options and engaging in kind of a shared policy analysis process. And then ultimately collaborating with them on whatever steps are taken. So again, making the community partners, not just in terms of not just in terms of the communication element of it, but in the actual operationalization of the response. And we've talked about this to some degree with when we talked about the biodetection and involving the public more in kind of surveillance work, where people would communicate if they see a sick bird or a bunch of sick birds in a park, or if they're a farmer and they have sick livestock, reporting that in a way that it can get to the right individuals and that information can be acted upon quickly. So exploring different ways where that kind of coordination can take place. So again, culture-centered approach is the idea of tailoring participation and engagement to each individual community to gauge their perceptions, attitudes, and knowledge before providing information or beginning to implement a new program. So basically, you can kind of think about it in the most simplistic terms as knowing your audience, knowing the community's attitude. So if we're talking about avian influenza, knowing, are we going into a rural community? Are we going into a heavy farming community? Are we going into a community where people are not inclined to trust government all that much? Are we going into a community that was severely negatively impacted by the COVID-19 pandemic in terms of its economy? Is it a religious community? You want to have an idea about all these factors going in, so that you can sort of anticipate some of the questions and the reaction that you're gonna receive and be able to respond to that, but also to sort of think ahead and start to brainstorm ways that you think you could engage the people in a productive way. So it says, in terms of avian influenza, the article says, such an approach could be used, the culture-centered approach could be used to encourage diverse participants to contribute to ongoing public health surveillance of emerging infections, such as those currently used in the H5N1 situation in the US, lending credence to morbidity and mortality information. So again, the idea that if the public is involved in collecting the data, they're more likely to believe the data. If the public is involved in crafting the communication message, they're more likely to follow the communication message. And so forth and so on. If people within the community are organizing the vaccination clinics, maybe more people might be willing to participate in the vaccination clinics. So it's important to, recognize that, for example, it talks about this Shastri research where community was used to try to encourage people to get vaccinated and overcome vaccine hesitancy by lowering distrust and things like that. But some people see that, can regard that as manipulative. Some people define community differently from other people. And some people see it as community as a term that government frequently uses to get people to act against their own best interests. I'm not necessarily saying that any of this is necessarily true, but it's important to recognize that, when we think of community, we usually think of it in a positive context. But some people can look at community in the context of a public health response and see it from a more negative perspective. So we have to kind of acknowledge that, and we have to make sure that if we're the ones doing the communicating, that we're not reinforcing that perception that community can be used in a negative context. So it talks about the National Biodefense Strategy, discussing goals relative to the culture-centered approach. So things like enabling a common US federal operating picture of spillover events, working with domestic public health, animal and plant health, and environmental health stakeholders to increase agricultural biosafety, biosecurity, biosurveillance for activities associated with potential spillover from animals to people, and reduce activities found to be drivers of pathogen spillover. So the term in the National Biodefense Strategy, the most recent one, they didn't use the specific term of the culture-centered approach, but they identified a number of areas where the culture-centered approach would be important because you want to reach across all of these different sectors to get, biosafety, biosecurity, biosurveillance measures that are integrated across the human sector, the animal sector, and even the plant sector and the larger environmental sector. So if we want to have well-coordinated, well-integrated systems, we need to utilize that culture-centered kind of approach. So it talks about how when we talk about the culture-centered approach, acknowledging that every interaction between scientists and community members changes the local communication ecosystem, which can be enhanced to promote ongoing trust, partnership, and improved health. So again, that idea that every communication, every interaction has an effect on the larger communication environment. And scientists have found this out the hard way in the past, because there's been examples of scientists going to events where they're answering questions from the public, and a scientist will be dismissive of a question from the audience, or they'll be patronizing towards somebody in the audience, and they won't really realize it in the moment, but that moment really hardens in people's minds and in their imagination that these scientists see themselves as better than the rest of the community. They feel like they know what's best for the community, and they're not going to listen to the public. And it really harms not only communication, but the ability to collaborate on other things as well. So it's important to recognize that, every comment, every interaction has downstream effects on all of the others, all of the other interactions to come. It's important, for us to define the boundaries of the public being addressed when we're looking at communicating. It can be national, local, or global. So it says, while many would point to taxpayers and racial ethnic minorities as interested publics, a complexity-informed approach to the culture-centered approach reminds us to include and work with groups typically left out of membership classifications, such as farm laborers, which would be really important for avian influenza, and other individuals who regularly come into contact with animals and would be expected to come into contact with zoonoses at an early stage. So again, that idea of reaching out to traditionally marginalized groups, including the homeless, because obviously, if we're dealing with a virus that's spread by wild birds, people who are homeless probably have more exposure to wild birds than any of us. And then once the publics are identified, setting approaches to engagement that are tailored to the local community. So engaging people in settings and in ways that are particularly targeted to their particular environment. So again, one of the questions that I mentioned earlier was, is it a religious community? Because is there a possibility to go to a church service or to go to some kind of regularly scheduled church event or church meeting and have a discussion there about being more prepared for avian influenza and prevention and control sorts of techniques. And then the idea that this whole process should yield collective learning. So everybody, should be learning from this process, not just the members of the general public or these particular groups that are being focused on, but the scientists should be learning as well. There's an idea in the social science literature about joint fact finding and how, scientists and the general public through regular engagement can learn important information together, which can help to arrive at better policy solutions. So ultimately, Shock-Spana says that engagement is justified on 3 bases: improving the quality of the product or the activity that's going to be undertaking, enhancing legitimacy, and building capacity, all of which are going to be important for an avian influenza response. So we want to have the, the best, whether it's the communication strategy or whether it's a surveillance program, whatever it is we're trying to create, we want it to be as strong as possible. We want it to have legitimacy, so it's accepted by the community, and we want it to have as much capacity as possible to do good in the community. So in terms of reaching out to the community, the article talks about access, people in the community, if there's a lab doing zoonotic disease research, people need to feel that these scientists are accessible to them, or that at least people from the lab are accessible to them to learn more about what's going on, and to feel more secure about that, engaging in meaningful ways. And this could be, interviews or attendance at different types of community events. But, people from these research labs that are dealing with viruses like avian influenza should be, making an effort to get it into the community, participating in learning and educational events to help the public understand the potential risks and potential rewards of their work. And then reflection is the final point here, where people should reflect on what they've learned about and from the community members. So people from the lab, whether scientists or other individuals, should reflect on what they've learned. Sort of take what they've learned and then incorporate that into future messaging, incorporate that into future public relations, but also think about it in terms of their own research and how they're looking at biosafety and biosecurity. And maybe people in the lab could take what the community members are saying and think about, are there any blind spots that we have? Are there any potential risks that the community members brought up that maybe we're not taking seriously enough? And then ongoing involvement to continue to assure the community that this is an ongoing process, that this isn't just a one and done, that there's an ongoing dialogue, there's an ongoing engagement going on. So again, this is kind of focused more on the relationship between these zoonotic disease research or research labs and the communities that they're in, but you can apply it more generally to public health authorities that are going to be dealing with avian influenza, or medical personnel dealing with avian influenza. Just having this ongoing dialogue, it's not just about in the event that something drastic happens, this is the information that we need to put out to the public to get them to act. It needs to be an ongoing dialogue, both to encourage trust, but also to encourage the most robust response possible, to get people acting as quickly as possible. And if people know each other well, and have been in communication with each other, the wheels are going to move a lot faster in those types of situations. So I'll wrap up that discussion here. But again, thanks very much for watching, and I'll see you next time.